failure is a sudden disruption of renal function. The common causes, categorized as pre-renal failure, intrinsic renal failure, and post-renal failure, are grouped by the location of the disruption. In pre-renal failure, blood flow to the kidneys decreases. A drop in oxygenated blood supply to the kidney damages the tubules. The rate of glomerular filtration decreases, and reabsorption of water and sodium increases. The resulting electrolyte imbalance can lead to metabolic acidosis. Pre-renal failure is caused by conditions that prevent adequate blood perfusion to the kidneys, such as hemorrhage, congestive heart failure, and dehydration. Intrinsic renal failure is when there is a breakdown in the nephron. Diseases of the tubules and collecting ducts disrupt normal reabsorption and secretion. Diseases of the glomeruli prevent the kidneys from properly filtering blood. Acute tubular necrosis is the most common example of intrinsic renal failure. Post-renal failure is caused by a breakdown of function in the ureters, bladder, or urethra. Renal stones and tumors are conditions that can block these ducts, leading to renal failure. Renal failure is the gradual breakdown of renal function. When the vessels leading to the kidney don't provide adequate blood supply, or the structures of the nephron are not functioning properly, the kidney's vital functions are compromised. As chronic kidney failure worsens, damaged glomeruli and tubules fail to properly excrete sodium and other ions. Urea and other waste and toxins build up in the blood. Vitamin D receptors in the kidney begin to fail, calcium absorption in the body decreases, and bone health erodes. The kidney's production of erythropoietin decreases, leading to a general decrease in red blood cell production. Chronic renal failure is caused by conditions such as hypertension that damage the kidney tissue, primary diseases of the kidney, and repeated cases of acute renal failure. Glomerular filtration rate indicates the severity of chronic renal failure and helps determine the course of treatment that can slow its effects.